biggest station in the world, playing all of today's hits. You're listening to Instinct Radio.
So I want to start off by just talking about the differences between HIV and AIDS, because some people may think that they're the same thing when actually they aren't. So Dr. Manning, you being the resident medical expert on the panel, you want to talk about the differences between the two?
I'm more than happy to, and I definitely don't want to insult all the hard work of my other colleagues who are here, who I'm certain can answer that question very well as well. But what I will say is that HIV is the human immunodeficiency virus, and what it does is it attacks the T cells of the body, which are the white blood cells in the body that are responsible for helping you to fight infection. We all have somewhere around 1,000 to 1,500 T cells at any given time, and what HIV does is because it infects those cell numbers start to dwindle, and as you have less cells to fight, eventually the number gets so low that the body becomes at risk for opportunistic infections. That is, infections that come for you if you don't have a strong immune system. And so once your T cell count reaches below 200, that typically is a designation of AIDS, or what we know as AIDS. But what I will say, in 2016, what's important to know is that many people who have had a T cell count or CD4 count below 200 who get on antiretrovirals and get in care, their numbers climb back up, their viral loads become undetectable, and they live the life of a person who is just living with a chronic disease. And so with all of the new treatments that we have, that designation isn't quite the same as it was when I was a medical student or a resident, say in the 90s or early 2000s. Now also, if a person does not have a T cell count below 200 and they have had certain infections, certain types of what we call opportunistic infections, that can also be a designation of AIDS as well. And it is still language that we use because it's important for prognosis for providers. So if a patient has AIDS, we have some idea about urgency, different things that we need to do, what they're at risk for, and again, what additional care that we need for them.
Awesome. That was a great explanation.
Y'all okay with that? You
Yeah,
okay with that?
yeah.
You approve? Okay.
Yes, most definitely. And thank you all who are listening, but also those of you who are catching us live via Facebook. If you are listening and you'd like to see what's going on inside the studio, you can visit our Facebook page at facebook.com/SM-LAC-DST. Now, I want to hand this one off to you, Candace, in terms of talking about kind of why you had a vision for this project, particularly to be able to bring both medical experts as well as activists in the community for World AIDS Day in this type of forum.
Well, World AIDS Day is a signature program for Delta Sigma Theta, and it is housed under the umbrella of international awareness. And so we wanted to do something. We do something different every year in observance of World AIDS Day, and so we decided this time that we wanted to do a virtual forum so that we could try to reach more people. But essentially, we want to make sure that we keep that conversation going in our communities because we know how important it is. And we're really excited also that on Sunday, we're going to be at Stonecrest Mall in Lithonia doing free HIV testing in partnership with the AIDS Healthcare Foundation. We'll be there from 1 until 5 near Forever 21. So we invite people to come out and be tested there as well.
Awesome. Skyy, I know that you are very active in working with women and girls as it pertains to HIV and AIDS. Do you want to talk about some of the risk factors that maybe you discuss with that population?
Yes. Oftentimes, and this is a big peeve of mine, that when we talk about HIV and AIDS, it's not just about sex. And so then we have to delve into those other issues. So with the programs that we do with Red Pump, it's candid conversations on why we make the choices we make, and then what can we do to make better choices, and not forgetting how important it is to know your status and the status of your partner, and how important communication is. So it's a non-traditional way to talk about such a heavy topic.
Awesome. If you all have any questions for our panelists, our experts, make sure that you type those questions on the screen on the Facebook Live page. You can also call in your questions at 478-569-6474, and we'll make sure that you get your questions answered. I want to talk a little bit about the impact of HIV/AIDS on the African American community, because particularly now, I think that, back in the 80s, when we first heard about HIV/AIDS, it was primarily a gay white male disease. That was what we thought of it. And now we seem to be in this community be disproportionately impacted by it. So I want to talk a little bit about the impact on the Black community. Larry, you want to talk about that and actually share some of your story?
Okay, so definitely. I myself have been living with HIV since 2007. I contracted, well, I don't know when I contracted it, but I know that I caught it when, as I was working at a community organization for Black gay men in Baltimore, Maryland. Speaking of Black gay men, that is the most highly impacted group, with HIV, and trans women as well. We wouldn't want to leave them out of the conversation because they also, contract HIV at really high rates. And the impact that it's had on our community is that it is added to the amount of stigmas and shame, especially in the gay community, because, as a Black family in general, we've already kind of tiptoed around the subject of queer identity and just sexual identity in general. And when you add HIV into that landscape, it made that conversation, being homosexual even more taboo. It made talking about sexual fluidity and sexuality in general more taboo, because you didn't want to be looked at as sick or less than and a sinner. So you go from being just a sinner to being a sinner and sick, and then the problem as it relates to Black masculinity and all of these other issues and taboos that we face. So adding the health disparity, HIV, into that landscape, it really muddied the waters a bit.
Now, this question is for anyone who wants to jump in. What do you think are some, and I think you touched on this a little bit, Larry, what do you think are some of the myths that are associated with HIV/AIDS?
I can speak on a few myths, and some of it comes from my experience in caring for patients at Grady Hospital, but also just in talking to people and living, right? So one of the first ones that bothers me, and I will be so happy if somebody can just jump in and counter me on it, but I'm very annoyed by this whole thing about down low.
Yes.
I'm annoyed by it.
Yeah.
And if you're watching and listening, I hope that let me say this. I don't know if you know any same gender loving brothers, and I know many, they don't want you. They don't want you. And actually, many of my friends who are same gender loving brothers, they want what I want. They want Netflix and chill with the monogamous partner. And if they don't want that, many of my friends are so very careful and thoughtful, just like and slip up like a lot of people I know did in college, and may do all the same things. And so really, as a provider, what I try to teach the medical students and residents is to focus on behavior.
Yes.
Focus on behavior. Don't get so caught up in who you are, right? Because many people who are same gender loving, they don't want to be called gay. They don't want to be called anything. They just want to be called by their name. And so I think one myth is thinking that some identity is coupled with HIV. I think HIV comes from, it is something that happens through behaviors, and so recognizing that. And then the other, I think, thing, at least in our community in particular, is that perhaps, the only way to get HIV is if you are a man who has sex with men, or if you're an injection drug user. And that is not the only way to get HIV. Certainly, anal receptive intercourse increases your chances, much higher chance, but still, heterosexual intercourse is responsible for a lot of HIV. Even if you already have some other sexually transmitted infection, say if you have syphilis and you have a sore, or if you have herpes and you have an open sore or something like that, then your chances are also higher of transmission. So it would really be awesome if people just knew if they were HIV positive or not,
Right.
and if their partners were HIV positive or not. You know, all these myths, it just really wouldn't be such a big deal.
Well, and I think another myth is that people think that you know what somebody looks like who has HIV.
Oh, yes.
Because I think a lot of the conversations don't happen even in heterosexual relationships. It's just an assumption.
Yeah. I think one of the myths that bothers me the most is that people who have HIV are promiscuous. Like, you got it because you were promiscuous. One of my business partners, Daniel Driffin, we just hosted this amazing art exhibit in his honor, and he caught HIV when he was in college. A lot of us contract HIV when we're in college and we're in that invincible stage of our life. We're not asking the questions, we're not asking about status. A person, at the same time as he seroconverted, one of his friends, one of his female friends, she became pregnant, and around her first sexual experience, one of his first sexual experiences, he seroconverted. It's as easy as that. You don't have to, it's not based on a number of sexual partners. It's not based on sexual proclivities. It's based off of high community viral load, which you'll probably speak to at some point. We're not predisposed as gay black men to get HIV. It's just a situation that we find ourselves in a lot of times.
There was, I just wanted to mention this as well. I think sometimes people think that if you're highly educated or if you're in the healthcare community that you've been voluntarily tested for HIV. As a healthcare provider, there is no person coming and throwing us in handcuffs and dragging us in somewhere to be voluntarily tested for HIV. I had been practicing medicine for a few years before the first time I was voluntarily tested. And the reason that I had not been voluntarily tested before then was because I was afraid. And I was afraid because I knew that at some point in my life I'd had a behavior that had put me at risk for HIV. And I was college educated and I was a physician, and really no different than what anybody else had done. I had a partner who said HIV status I was not sure about, who I'd been with, and I'd been put at risk. And I say that out loud because I think what prompted me to go get my first voluntary test was a patient at Grady telling me, who I tried to convince to get tested. She said, "You probably always get tested. It's different for you doctors," but it really wasn't. And it was a good friend of mine who's a colleague and who is a same-gender loving brother, who said to me, "Stop saying that being a black woman and the high prevalence of HIV in black women is what has you scared. The reason you shook is because you did something.
Right.
Because if you're a black woman who did nothing, you ain't got nothing to be scared of. And if you're a man who likes men, and you're black, and every man you like is black, but you haven't done nothing, you ain't got nothing to be afraid of, right?" So I think that there are also myths on the other end. There's the extremes that are negative, but there's also these myths that you think everybody in this group is all squared up and laced up tight, but that's not true.
Can you all talk a little bit, and that's great, about, I guess, some of the myths you all mentioned in terms of being able to look at someone and tell, and then particularly as I think it was 1991 when Magic Johnson came forward and shared his status. We've had a few people who are in the public eye who've shared their status, I believe Greg Louganis, but then most recently Charlie Sheen was kind of forced to share his status. How do you think that those people who are in the public eye, who are prominent, whether they have lots of risky behaviors or not, how do you think that impacts the way people view whether or not they're at risk? Did that question make sense? I saw everybody looking. I was like, did it make sense?
We're just trying to think who's going to.
It does, but when I think about if the general public, if it makes them think they're at risk or not, I don't think so. Because at the end of the day, most people can't relate to Magic. Most people can't relate to Charlie. For one, it's a different income bracket. So it's like, that's the thing. You have to be able to touch and see people to relate to them as if the virus could affect you. Because people look at Magic and they don't really think he has HIV. They don't think he ever has, because he looks healthy.
Some other thoughts I have about Magic Johnson is I think that all of us, if you have influence, you have to be a really responsible steward of your influence. And I have to say, I applaud Magic Johnson for in 1991, which is crazy. That is a crazy time for him to have told the world that he was HIV positive when he didn't have to. With so many years that have gone by, I think at first there was this period from like maybe 91 to 2000 when people were like, Magic has some special concoction they're giving him. But now Magic Johnson's been around long enough where that the whole concoction thought is starting to go away. And I think maybe there's somebody somewhere who might look at Magic Johnson and say, hey, you know what? I can actually be married and in love, take my medicine, my spouse won't convert, my kids can grow up, they can live their lives. And the coolest thing I think about watching Magic Johnson is that he doesn't seem like he's thinking about the fact that he's HIV positive every single day. And because of that, we aren't. And so if he's on TV and he's talking and I'm not thinking about the fact that he is a man living with HIV, I just think that's dope. I do, and I just hope if even like 4 people can feel that way too, if they're in care, you know what I mean? I think I'm impressed with him. I don't know what Charlie Sheen is up to.
But I think it's more impactful for women to see someone like Cookie or Ray Lewis Jordan. That's more impactful for a woman who is now diagnosed with HIV and thinks that she can never find a man who will love her or be able to have children and that kind of thing. Yeah, they see Magic, he's a guy in this, but how does that really make a woman feel? It'd be different, you know, if it was the other way around. Maybe Cookie was positive and Magic was negative. But I think with Cookie sharing her story, more women can say, oh, this is possible for me. And that was the new thing with her new book. Now it's a new hey, because with us, if we don't keep it in the forefront of our minds, it's not there. And it has to be more than World AIDS Day or National Black HIV/AIDS Day. You know, it can't be those one-offs.
Something that you were getting at is like normalizing HIV to the point where, and that's what I think that the celebrities help to do. They help to normalize the conversations around HIV, but then normalize HIV in general. So like you were saying, you know, you see Magic Johnson, you're like, he's healthy, you know, if you're an HIV positive man, you're like, or HIV positive person in general, you're like, well, I can take my meds and I can be healthy and I can live a healthy lifestyle and stuff like that. To your point, I wonder if there's more to that as to why we don't see more women who are out about their statuses. I think that, I mean, obviously we can break it down to like patriarchy and stuff like that, but like I wonder why women feel like highly stigmatized around, you know, HIV. But in my mind, I'm thinking it's because, you know, even being a woman is highly stigmatized in its own right. You know, sexism, like I said, patriarchy and stuff like that. But I wish there were more role models in that right. You know, who are of, I guess, like people of like high stature, so to speak.
Again, if you have any questions for us, make sure that you log on to facebook.com/SM-LAC-DST. You can phone in your questions to 478-569-6474, and we will get your questions answered. Larry, I want to come back to you and talk a little bit about your story. You mentioned that you found out you tested in 2007. What was that like, that initial notification?
So initially it was just, I was shocked because I worked at not an AIDS service organization, but I worked at a community organization that focused on, you know, largely on, you know, men's health, but HIV was one of our, you know, subject matters. I felt shame because, you know, I was supposed to be one of the ones who knew better, you know. Here you are, you have access to, you know, testing, you have access to the information. So initially I felt like shamed. I felt like, okay, even though I'm gonna live and I'm gonna be healthy, I'm gonna, you know, enroll in care and take my meds and stuff like that, I felt like it was something that I couldn't talk about because it's like, you should know better. Like, you're college educated, you're, you know, this role model, you have this standing in community, you know, how can you, because it's like, and I felt like it would do damage to my mission to, you know, to speak out as somebody who's newly seroconverted in 2007 while working at a center. So I kept it private. I did. I worked in the field probably 7 years longer. and did not tell anyone. And I even facilitated HIV support groups and was very, it's good. You could live with it. Very just hands off. Very much, I'm your ally, not I'm your brother, just like you. Right. And what that did for me was, while my T cell count came up, and I was healthy-ish, right? But my mental health was not there. It really impacted me mentally. It impacted me when I would hear people having conversations about HIV, and I would think, like for a second, like, well, are they talking about me? Do they know about me? How am I looking today? I became really insecure, and just saying the words, just saying the words out loud, I am HIV positive, was cathartic in a way that I could have never imagined. Like, my whole life, my whole mental health started to catch up with my physical health. Wow. Another thing that happened was that, while being recloseted around the subject matter, people in my life who were dealing with the same thing were not able to glean support from my story. So I actually had to go through watching a close family member, not necessarily succumb totally to HIV or AIDS-related complications, but to basically become a shell of themselves because they had held this secret for 20 years. A female in my family, actually, and somebody that I would never think, because I was so wrapped up in my own insecurity, that I didn't think that my story could actually help anyone more than another Black gay man. Right. And then definitely not anybody in my family, because nobody in my family is gay, nobody in my family is HIV positive, in my mind. And now that's why I encourage people to speak out, and in your own time. Like, I'm not gonna say, oh, you're positive, now go tell everybody, but understand that the pill can only do but so much. I have in a poem I wrote, there's no pill that can rebuild will, and I think that the pill that rebuilds will is that the owning your reality, whatever that reality is.
Were you in care?
I was in care.
Okay.
I was in Baltimore at Johns Hopkins Hospital.
Okay.
So, like, very much on my care, very much took my medicine and stuff like that. But whenever I would have, like, friends over, or I was at a family member's house, I would hide. Just imagine being a grown-up, paying taxes, paying rent, hiding. It makes you feel bad. And what I've learned is that even if I take my pill, if I feel bad about it, it's going to impact my health, my mental health and my physical health.
I think that point that you made just now, I want to make sure everybody gets that, and it is that in 2007, Larry wasn't ready for everybody to know, but he was in care. And I think that our HIV and infectious disease teams that care for patients living with HIV, if they could just implore people to do anything, it would be to get in care. Then whatever we can do to try to keep you in care, because there's getting in care and staying in care are, of course, two different things. So one of the things that Larry said was, well, everybody is not going to be ready to, put it up on Facebook as a status change if they find out that they're HIV positive. So if you need to do it in your own time, then do it in your own time, but get in care so that you can protect yourself, but also protect the people that you love. And I think that's a really good segue to maybe pre-exposure prophylaxis, because if you are a very high risk person, and I'm sure some others can speak on this too, but very high risk individuals, 2016 is so awesome because now you can actually take a pill once a day, really simple, like a vitamin, basically, that can cut down the chance of you getting HIV if you're with an HIV positive partner by like 92%. It's crazy.
That's amazing.
And then if you are in love with someone who is living with HIV and they are taking their medications and they're in care, you just live your life like any old boring couple like the rest of us. And that transmission is I mean, it is not even just a little bit. We're not talking about, it takes it down like 10%. We're talking like high 90s, 96, 97%. So this is a big deal. And that's why this whole point about getting in care is so important. So you can meet and fall in love with somebody really hot and find out they're HIV positive, and if they're in care, your job need to just be to keep them in care.
Exactly.
You know?
I think that that's our job as a community in general. You're talking about that treatment as prevention piece, just learning to deal with our stigmas so that we can help. You don't have to date someone to encourage them to take care of themselves, encourage them to be in care, encourage them to reach undetectable status. I think that, but in order to get to that place, I have to feel like you're not judging me.
Right.
You know, in order for me to speak freely about my status, I have to feel like, you know, this is a safe environment. And what we need to do in order for all of us to help to work out this HIV epidemic is to make our communities safe. So when you hear somebody that's say, oh, I'm HIV positive, or that person's HIV positive, not defaulting at, oh, I'm sorry, or, you know, but asking meaningful questions like, so where do you receive care? Like, you know, I mean, and keeping it very on the up and very positive and very, you know, very useful to the person, giving them something that they can use as opposed to your sadness, because a person can't use your sympathy.
Right.
You know, that it's just gonna, you know, you know. But like keeping our community safe, and I think that the ways that we keep our community safe is that we keep it, you know, positive and affirming, and not judgmental, and not, you know, creating this negative. Because I mean, even when accessing care, my first times accessing care, I would wear glasses and a hat. I was scared. So if somebody told me that they were sorry that I was HIV positive, when I went, I felt sorry, or I didn't go because I didn't want to feel that. You know, I didn't want to feel that. So.
Now-
Can I just say, I'm sorry.
Go ahead.
That's what I love about your organization is that it's such an awesome support network. And so I think that's great to be able to have that, you know, a group of people who can relate directly to what you're going through, because the mental health piece that you discussed, that's so important. So.
Yes.
And just to touch on what you were saying with PrEP, we just want to make sure that, yes, there's PrEP, but we want to use condoms as well. You know, because when we talk about this, it's not just HIV, there's other STIs. So that's really good. And then to even get to what you're saying, supporting those living with HIV, first, everyone needs to know their status. You know, there are so many girlfriends and friends and people I know. I'm in a monogamous relationship. I'm good.
And?
Or even with the guys. She good, so I'm good. No, go and be good for yourself, that you know that you are. So we all, like you said, once we know, we can get into care. And if we know that we don't have a positive status, we need to continue doing what we're doing to stay that way. So it's critical. It's so many people that don't know their status.
I wanted to piggyback on something that you just said, you know, that sometimes people may reveal to a family member that they're, you know, HIV positive, and they're like, oh, I'm sorry. How do we move our community and educate our community even around that? You know, I think that there's a lot of education, even though people don't always take advantage of it, around ways to prevent contracting HIV. But now, how do we educate our community on being the right type of support? I mean, it's almost like, for me, when I think about how we deal with people who lose someone, like lose a loved one, we never know what to say. It's, you know, I'm sorry or whatever. We don't have the right words. And people do the best they can with that, you know, because I know I've said some stupid stuff to people, you know, at a funeral, you know, like, why did I just ask her that? No, like, that was the dumbest thing. And or I lost my sister. Some of the stupidest things people said to me, and I knew they meant well, they just didn't know what to say.
Right.
So then how do we start educating people on the best way to interact and be supportive to those people who may find out that they're HIV positive?
Well, I would like to think that maybe this conversation is part of that solution, is having the conversation, having the dialogue. And, you know, people that have the courage, like Larry, to talk about their status and what they're dealing with, so that we can see, you know, this could be my neighbor, this could be my brother, my cousin, whomever, and it's okay, you know, and we can still support him. So I think that the conversation is really important.
I think the point that you made about nobody can do anything with your sympathy, I think that's really an important point. I can actually be sorry that you have a new normal, and that you need to navigate something that you did not have to navigate before, and now you have to think about something that you didn't really have to think about before. I am sorry to hear that, but I don't feel sorry for you, and I'm not going to be slow singing and flower bringing to you. And I do think there's a difference between being sorry that somebody has to kind of just deal with something. But then it's just time to kind of say, all right, I'm here for you. Can I give you a ride? But also to hear from them, I think, and I would love to hear Larry's perspective, because every single individual living with HIV, what they're scared of is different. Like there's some patients that I've met, I tell them they're HIV positive, 46 years old. They're like, word, okay, where do I need to go? Right. Give me my pills. Take my pills, and they just keep it moving. But hearing somebody else get that diagnosis, it's different. And one piece of empathy that I think I gleaned from a patient a couple years ago was a patient who didn't have health insurance, lived in town Atlanta, and had a T-cell count under 200. And in Atlanta, Georgia, we have one of the most phenomenal infrastructures for HIV care in the United States, even for low-income patients, particularly at Grady at the infectious disease program on Ponce de Leon. And that's where he needed to go. And my patient was afraid to go to the Ponce clinic because he said, I am a 20-something-year-old man who has sex with men, and all the children know what goes on there. And if I go even get off 2 stops before then, and I'm walking that direction, people are going to know what's up with me, and I'm not ready to tell people. So this really simple thing was keeping him out of care. And so we ended up coming up with a whole discussion. Don't come off of Ponce, come from north. Come over by Krispy Kreme, do this, go through here. We had a whole strategy to just get him in the building because he didn't want to be seen, because he caught public transportation. And that I just never even thought about that, because I'm not living every day with his peer group and his community. And so he helped me with a new set of empathy for my patients, who now I'm like, are you nervous about where you'll get care and who might see you if you go to Ada Atlanta, or if you go here, And it turns out that for some people it is. So I just ask people, what you scared of?
So that's exactly it. So it's, as opposed to, and right, you're right. So you do feel like, wow, this is new. This is probably making you feel a certain type of way. So what it's best to do is educate yourself on it, the virus in general, but then also asking a person so what is occurring for you right now? How are you feeling? Coming up with a strategy, meeting them where they are. You have a problem going through the front door. I know somebody that might get you through that back door. Let's kind of get you a route, And I think that's what it is. It's actually figuring out for a person, what are you going through, and then let's deal with that, as opposed to me putting all of my expectations and judgments of what it means to be HIV positive on you, and then you having to navigate that as well. So for me as a tester, sometimes I test at Ada Atlanta, and whenever they get somebody who's newly diagnosed, they always call me up, because they know that the way that I deal with them, generally they leave smiling, laughing. I've already added them to, my network and stuff like that. So, I'm really good at bringing you back up again. And the way that I do that is I understand. One, I'm positive, but then two, I'm I work with where you're at. Everybody's not this is not earth-shaking news for everybody. It's well, what do I tell my boyfriend? That's what I want to really deal with. Or how do I tell my mom? Or my world is over. Some people go there, but you can't. It's incumbent upon us as people who know better,
even for low-income patients.
And that's more what I'm talking about. Just gauging and asking, how are you feeling about this? And what things how can I help? Or how are you feeling? And this is what I know. This is what I know, from what I've read. Or, this is a cool group. I met Larry at a panel discussion. Let me give you his number. Or something like that. What I'm talking just about. Useful stuff, as opposed to your stuff and then their stuff.
Right. Yes, and I think we fear what we don't know. So that education component is critical. Because if we hear, and I'm thinking, someone hears that a family member is HIV positive, they don't know about it, but what they've heard or seen on the news, about how it's transmitted and that. And so what we project at that point is all negative. Don't come to my house. eat off a paper plate. This still happens in 2016. You know, all your cutlery has to be plastic. Go wipe your seat, use the bathroom. So we fear what we don't know, and so we're projecting that fear. So it has to be education. This is the hardest topic to talk about. It's so unsexy. But until we get to the core of the basics of it, then there'll always be that stigma, that discrimination, and I don't want to deal with you.
And we have a question on our Facebook page. This is coming from Stephanie Singleton, and I think that this question is actually directed for you, Larry. The question is, what are some examples of the most supportive things your friends and family did to help you come to terms with having, and she has AIDS, but you are HIV positive, so I will make that that distinction.
And actually, because I was so private about my status with my family, I didn't give them an opportunity to really support me. And when I did come out about it, I was kind of like very cut and dry about it. Like, you know, I'm good. It's been years. I don't need tears. Like, you know, and let them know, like, it's been years. I don't need tears. Okay.
It's been years. I don't need tears.
Yeah. So, but like with my friends,
You should put it on a shirt, Larry.
with my friends, I mostly spoke to my friends that were HIV positive and thriving with it. And what they did is they referred me to resources. You know, where do I go? When should I go? Am I gonna have to wait a long time? You know, does this hat and glasses make me look ridiculous? You know, and just support, just hearing me out. At that time, I mean, and still, like, HIV is a chronic illness. There's nothing anybody can give me to rid me of HIV, but lending me your ear can help can rid me of a lot of these crazy thoughts that are going to keep me out of care. So just hearing a person, and that's with any situation. You know, I had a bad day. Like, if I come to you and say I had a bad day, you're not going to instantly start telling me about your bad day. You're just going to let me talk about my bad day. And I think that that's the empathy. It's the medication that you can give me. It's the listening to me. It's the let me discover this with you. Because you might not know about HIV. You might not know anything about HIV. But it's just, well, let's learn about this. You know, what are we going to, like, let me educate myself on HIV, and let's educate ourselves on HIV. Do you want me to come to your visit? Do you want every conversation to be about HIV? Like, you not want to talk about HIV? You know what I mean? Like, I remember my roommate was one of the first people when I was in college that I found out was HIV positive. And I didn't know anything about HIV, so all I could do was be like, let's go out to eat. And till this day, he's like, I love that response to me being positive. Like, you just treated it like, well, okay, let's go eat, you know, and let's go talk about life, and, you know, I'll come to your doctor's visit. And because I didn't know, so I didn't want to freak him out by my naivete. It's like, you know, you don't have to educate me. Let's just have a good time. Let's just talk and be, you know. So
I think that's so cool too that you were supportive, or you've had support, but still respecting that it's a chronic disease, right? And so I think that thinking about the pendulum that way, you know, on one end, you don't want to be so somber that, like, oh my gosh, oh my baby, I'm gonna put some oil on you, you know. But then on the other end, you don't want to trivialize it either. A patient told one of my colleagues who works in infectious diseases, said that my colleague was going on to the patient about how, you know, this is not a life sentence, a death sentence anymore. HIV is not a death sentence. But the patient was like, but yo, it is a life sentence. And, you know, if you think about it, a life sentence is still a big deal. And I think when I heard that, that made me take pause and say, hey, you know what? Let me respect the fact that now I'm asking you to hold on to a ball and not drop the ball. A ball you did not have to hold at all before. And so if you kind of need to, like, just talk about the fact that, dude, I'm just, like, tired of having to even think about this. I'm 25 and I got to come get blood checked and do all these things I don't want to do. So I can just hear you out and be like, yeah, that's kind of, but, you know. Anyway, after I hear about that, then I say, let's go eat. After that, let's go eat.
So we're getting ready to start winding this down. And before we do, I'd like to just go around the table to each one of you in terms of some final remarks, in terms of resources, that you can talk about for people who are listening, people who are on our Facebook live page? And I will mention our number one more time, which is 478-569-6474. If you happen to be listening in, if you have a question, we're going to be wrapping up at 7 o'clock. So if you have a question, you can call that in or ask that on our Facebook Live, which is facebook.com/SM-LAC DST. But Dr. Manning, any final remarks in terms of resources, advice?
Okay, well, I will mention just a couple things that we didn't get to, and one of those things is that in the African American community, there are a lot of factors that cause HIV to be a little people to be more likely to get HIV in our communities. One is that African American folks, they like other African American folks. And so oftentimes our sexual partners stay within our same demographic, and it's already a higher prevalence. So that increases prevalence. So people should just kind of be aware of that. Other things I think is, as we know, socioeconomics are at play, and that could be its own hour discussion. So I'm just going to leave that right there. And a lot of risk factors go along with that. So I think being aware. I think that if somebody had to if everybody just forgot everything we said, and they needed to take something, I would just hope that you know your own HIV status, that you get a voluntary test, and if you do anything or have something that puts you at risk again, that you continue to get voluntarily tested, and that you stay fully aware of what your own HIV status is. If you do get a positive HIV test, to get in care. Find, if you meet a doctor when you first get in care and you ain't feeling them, go get you another doctor fast so that you'll stay in care. If you are having trouble tolerating your medications, tell your doctor right away, please don't stop taking your medication, because it makes it much harder for you to fight the virus later. And so if you aren't able to tolerate your medicines, we have a lot of different variety of medications to offer. And I would just say probably one of the last things is that I think as responsible people, and also I know a lot of people of color are watching this, it's really up to us to start shutting down some of these things that are being said about people. Regardless of what you believe, regardless of to whom you pray and what you read, we know that first in everything is love. And I really do think that this whole idea of telling people that they had something coming, or thinking that you're separated from something, it just makes people hide more. So when you hear of somebody saying something about homosexuality, if you see a guy walk by and he has a little extra pep in his step or something like that, be careful about how you wrinkle your nose or grimace your face, because that could make him hide. Just that alone could be enough to make him hide and harm himself later. So I just think we need to be responsible about our influence and about what we're doing, so that we can get people to feel comfortable getting the care that they need. But know your status, and if you high risk, get you some PrEP, because it's easy to take.
That was amazing. I'm just like, continue. Could you touch on PEP just a little bit?
I know.
I kind of want to defer back to her to talk about PEP a little bit.
Okay, yes, thank you. Post-exposure prophylaxis. So there's pre-exposure prophylaxis we talked about if you're high risk, but actually if you've been exposed, not just through a sexual encounter, but also for us in the hospital, that happens to us where you get a needle stick or something happens unexpectedly. Post-exposure prophylaxis can greatly reduce the chance of the virus kind of setting in and causing you to be HIV positive. So if you have been exposed, or if you've had a high-risk encounter, then immediately getting to care. So you could go to Grady Hospital for that. You could go to Aid Atlanta. There's so many different places that you could go. But if somebody tells you no, or they act confused, leave. Go somewhere else. Because this is Atlanta, Georgia. And let me tell you, one thing we do well in Atlanta, Georgia, even if you don't have no money, is we know how to take care of HIV. Particularly, I mean, I'm biased. I work at Grady Hospital, but Grady and we partner with everybody because we all in the fight together. So we just want people in care.
Resources: ThriveSS.com. It's completely 100% run by people living with HIV, people who do the work, people who are community health educators, people who have done. We have decades of knowledge under our belt. We are connected to most places in the city. We can connect you if you just want to talk to somebody about your your status or disclosing or something like that. Definitely visiting thrivess.com. Calling the Georgia helpline is also very helpful for people who might want to engage into care but they don't know where to go, where to start. Myself, Larry L. Walker on Facebook. I'm always available to to connect people. That's what I do for work and for work. So yeah.
Awesome. Well, for a resource, I'll say cdc.gov//HIV. That's our number one. That's the web page that gets the most hits. So people are curious. They're interested. So if you want to be private and still want to know, go there. And as far as just a piece of advice, as women, we have to have the conversation with each other as well as our partners. And we're normalizing HIV. We need to normalize sex. Black women are having sex, and that's the truth of the matter. So let's start having these hard conversations for self and for others.
And just as a reminder, again, we're going to be at Stonecrest Mall, partnering with AIDS Healthcare Foundation, and they will have their mobile testing unit there for free HIV tests for anybody that wants one. So we'd be happy to greet everyone at the mall. We'll be there from 1 to 5 on Sunday.
Awesome. And we still have a few minutes left. So we've talked about resources. We've talked about how people who may be listening can find information on the web. We have our event coming up on Sunday. Are you all aware of any other events that may be coming up in the area? Either more discussions where people can kind of see the face of HIV and see and talk to someone who can speak from a different perspective.
I wouldn't say so much about things that are coming up, but more ongoing. I think that no matter where you live in Georgia, the health departments, but specifically the Fulton County Health Authority, which is directly across the street from Grady Hospital, is a tremendous resource. The CDC poured in millions of dollars into all of these outreach programs and ways specifically to reach our community. I think last year was like over $300 million given toward health departments to help with our efforts in educating, retention, getting people into care. So if you live in a county somewhere in Georgia and you sort of don't know what to do, you can go to the health department and get tested. AIDS Atlanta is where I got my first voluntary test. I was scared to go get it at my job. And so just don't be afraid. And I would say don't think of this as something that is just the thing we talk about on December 1st and 2nd, if the 1st was a Thursday. But make it sort of your business to be thinking about it year round. And yes, a lot of people are having sex, and stuff can happen when you do.
Skyy, do you have a website for your organization, Red Pump?
It's the redpumpproject.org.
The redpumpproject.org. All right. So we have the redpumpproject.org. We have thrivessc.com or .org?
ss.com, I'm sorry.
thrivess.com. Also, we have SM-LAC.DST.com. Org. I was thinking it was .org. And are there any other websites that we want to mention as we get this wrapped up?
Well, there's tons there, and for Atlanta, there's Sister Love, and then with the health department, there's Greater Than AIDS, Women's Empowerment Resource Center for Black Women's Wellness. It's lots of organizations that you can just tap into, not only about HIV, but holistic health, whether it's, nutrition, mental health. So we want to take care of the whole mind, body, and soul. So just still get connected. And even not for yourself, then you have a resource for someone else that might need it.
Yes. And if you're young and same gender loving, maybe NASEM as well as the Evolution Project, a program of AIDS Atlanta. Those are great places to go and just meet people like you, young, black, gay, trans, a safe space. Also, each college has, GSAs. Safe Space is one that I helped to co-found at Morehouse. So definitely finding support. And one of my last comments will be just to, similar to what you said, if you hear somebody saying something, or you said saying something stigmatizing or something that just seems like it breeds hate, challenging it in the moment, just showing yourself as an ally can do so much, to embolden a person and make them feel like, comfortable and less shame. So.
All right. Well, I would like to thank our panelists, Dr. Kimberly Manning, Larry Walker, Candace Hull, and Skyy Banks. My name
Angela,
is...
I'm sorry, before we wrap up, I just wanted to mention that we do have the survey link available. We'd love to get feedback from our viewers to know what they thought of the program tonight.
Absolutely, and that is on our Facebook page. If you are listening in live on the net, but you're not on Facebook, you can visit our Facebook page. Again, that's facebook.com/SM-LAC DST. Any other final comments as we wind this down? Thank you all so much for giving of your time and your wealth of information. It's definitely been my pleasure to be a part of this. I think I've learned a few things. And there was something you said, Dr. Manning, earlier that I was like, okay, I think that is lingo I am not familiar with. And it may have been you talking about converting.
Seroconversion?
Yes, and I don't know. I mean, that was new to me, so I was like, there may be somebody else who don't know what that means.
That is just a person who was HIV negative before becoming HIV positive. So that is called seroconversion.
Okay.
That was medical jargon, and so you just called me out for using medical jargon.
Okay.
So that means you was negative, but then you got positive.
Okay.
Thanks for breaking that down.
Yes.
Yeah.
All right. And again, thank you all so much for listening. If you could take the survey, let us know what you thought about this panel. We would greatly appreciate it. Facebook.com/SM-LAC DST.
Thank you.
Thank you all so much.
Awesome.
Have a great evening, everybody.
The biggest station in the world, playing all of today's hits. You're listening to Instinct Radio.